Hello and welcome to Med4 Care. Today's topic is general anesthesia, induction, maintenance, and awakening. Let's find out what it is. Pre-oxygenation. Before induction of general anesthesia, the patient is subjected to pre-oxygenation, a procedure in which he is invited to breathe pure oxygen with deep inspirations, with the mouth, for about 3 minutes. This allows you to change the concentration of gases within the lungs, raising the normal concentration of oxygen that is normally 21% up to much higher values. This allows to obtain a lung rich in oxygen to the induction of anesthesia, and therefore also more time to perform in greater safety tracheal intubation maneuvers, during which the patient cannot breathe independently. Induction of general anesthesia. Induction of general anesthesia is a phase comparable to the takeoff of an air flight. As the airplane passes from the runway to the air, the patient goes from the waking phase to the phase of deep sleep and the impossibility of breathing autonomously. For this reason, once asleep deeply, the anesthesiologist proceeds to the management of the airways, that is, to the positioning of a device that allows to insufflate the air in the patient's lungs. It's also possible to resort to tracheal intubation, which involves the insertion of a plastic tube into the trachea, to allow you to insufflate air into the lungs with a specific machine, the mechanical fan. Alternatively, in specific and limited cases, you can use the laryngeal mask, a device that does not fit into the trachea but remains above, in the oral cavity and pharynx. The maintenance of general anesthesia. This moment of anesthesia can be compared to the altitude phase of an aerial flight. The techniques used for the maintenance of general anesthesia are usually two: the TIVA or total intravenous anesthesia, and the use of halogenated gases through the anesthesia apparatus. TVA for the maintenance of general anesthesia. General anesthesia can be maintained with continuous intravenous infusion of anesthetic drugs. The most widely used and widespread is propofol. The infusion can take place in two modes, simple TIVA and TIVA TCI, or target control infusion. In simple TIVA mode, a simple infusion pump is used, which determines a continuous and constant infusion of the same amount of anesthetic over time, which can be manually modified as needed. The target control infusion mode instead requires the infusion pump to follow a specific protocol, designed on the pharmacokinetic properties of the chosen drug and adapted to the specific parameters of the patient. Based on the parameters provided to the pump, the system calculates the kinetics of the drug and independently determines the amount of anesthetic to be infused. Halogenated gases in the maintenance of general anesthesia. The maintenance of general anesthesia is also possible with volatile anesthetics, improperly called gaseous. These are agents administered by inhalation, inside the circuit of the artificial ventilation machine. The patient breathes a mixture of air and anesthetic, which reaches the nerve cells and keeps them inactive, inducing hypnosis. Volatile anesthetics, or halogenated, also have analgesic and muscle relaxant effect, so they can exert a synergistic action and combined with other general anesthetics. The main gaseous anesthetics currently in use are sevoflurane, desflurane. The awakening from general anesthesia. In some cases, for logistical reasons, it is possible that the patient is transferred, still asleep and intubated, in another environment, called recovery room. It is a dedicated place where it will happen in awakening in the presence of a nurse and in some cases, a dedicated anesthesiologist. This last phase of anesthesia is compared to airplane landing. In the case of maintenance with intravenous anesthesia, the continuous infusion of the drug is suspended, which is disposed of gradually. In the case of gaseous anesthesia, the flow of gas inside the circuit is interrupted, and the gas present in the brain and blood is pumped out of the body thanks to the respiratory system. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, support us with a nice like and subscribe to the channel. See you soon on Med4 Care.